stools very soft.
If a child is coming home from the hospital and seems like they're making stools and maybe a couple of times gets hard, what would you give it good advice for a parent when the stool gets occasionally a little bit hard but is passing it?
The first is to increase the amount of fiber in the diet.
Which can be done in a baby how?
Well, in a baby, it's a little bit of a different situation. Most babies are only on formula, and some of the formulas can be more constipating than others. One can use prune juice or corn syrup to help soften the stools and increase the amount.
It's called what, Caro syrup?
Caro syrup is the brand name that we usually
And it
push.
comes in a light and a dark. I hear the dark is better than the light. Is that true?
The dark has extra fiber in it, and the dark is what you should be using for treating the constipation.
If it's a little bit older child, it's an occasionally constipated kid, what would you recommend for a parent to do at that point?
You could use psyllium seeds like Metamucil. You could use Benefiber, one of the commercially available fiber supplements.
Are there any foods, say a little bit older child, you should avoid if they're constipated?
Bananas are the big ones.
Bananas. Are there any foods that you would encourage in a normal diet to help control?
Yes, you would cover whole wheat bread, fruits, vegetables.
Any kind of
beans.
cereals are better than others?
One would look at the cereals and look to have at least 3 grams of fiber per serving.
So the rule for adults and kids is sort of like close, isn't it?
Yes.
More fiber, more stool production. Is that correct?
That's correct, although it's often very difficult to get kids to eat the foods that we would like them to eat, which are high in fiber.
So in other words, if a kid is constipated, especially very early, we want you to check with your doctor, make sure we don't have anything serious behind it. But we should always realize constipation, many times, is caused sometimes by behavior things which you had mentioned before. And we should be aware of that, and a good history is very important. Is that correct?
That's correct.
Thank you, Dr. Jelin.